Hey YouTube, it's Marita from the Nurse Lounge, and today we are doing a video based on a question that I received from a IG follower, I think. So this person DM'd me and said that she was a high school student who wanted to know what classes should she take for preparing herself for nursing school. So, I've never really addressed the high school student on my channel, which I'm excited that she actually asked me the question. So if you want to see what I said to her about what classes she should take in order to prepare herself for nursing school, then stay tuned. All right, so we're gonna jump right in. Again, this video is inspired by a student who is in high school currently who wants to be a postpartum nurse, just like myself, when she grows up. So what classes should a high school student be taking? So if you are a parent or if you are a student yourself and you're trying to figure out what career path you want to take, and you happen to think that nursing is the career for you, then you need to listen to some of these classes that you should be taking if your school offers these programs or these classes. So first and foremost, I want to start off by saying or introducing myself, because the high school group is a new group for me. I have never thought about high school students watching my channel. So now that I am aware of at least one, and I'm sure there's more that watch my channel, I definitely need to kind of say things in a way that makes sure that they understand exactly what I'm saying and that they are well versed on what they should be doing to prepare themselves for college. I've always talked about preparing yourself for nursing school, which is usually the adult learner, truly the adult learner. So first and foremost, my name is Marita, in case you all don't know. I am a registered nurse, been a nurse for 15, going on 16 years in June. I am a doctoral candidate at this point. I will get my doctoral degree. I will actually defend or disseminate my project next week. So just so you all know, I am getting my doctoral degree in executive leadership, and I will be finished next week. So I'm excited about that. Graduation for now is, I don't know when we're going to graduate, but nonetheless, I will be done. All right, so my background in terms of clinical wise is OB/GYN, well baby nursery, and I am a nurse educator. My master's is in nursing education. Now that we have all that out the way, let me go ahead and address exactly what this student wanted to know. And she wanted to know, what is it should she be taking to prepare herself for nursing school when she goes to college? Now, I want to also say that you should be making sure that your GPA is very, 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 very high. Nursing programs are very, very competitive. Most of them want you to have in the upper 3.5s and above to get in, the ones that are competitive, mind you. And GPAs are set at the freshman level, not at the junior and senior level. So you want to make sure first and foremost that you go into high school. So I'm now really talking to my 8th graders at this point. You want to go into high school, going ahead and preparing to have work your best and your hardest that freshman year of high school, the same way you would your freshman year of college. Why? Because you take all these classes and your GPA starts to build based off of your freshman classes. If you are having a low GPA, it is very hard to change your GPA again without retaking those classes. Now in high school, a D is passing. So if you make a D in high school and you're passing, that is the grade that you're going to get. And if you want to get into a nursing program or go into nursing, you have to be competitive. So go ahead and have that mindset very early on to work very, very hard at getting that GPA as high as you can possibly get it. All right, now to answer her question, which classes should she be focusing on when it comes to getting into a nursing program? And keep in mind, you have to go take prerequisites even in high school. In college. You take your prerequisites, and then after you take your prerequisites, then you actually declare nursing as your major. So you do pre-nursing core classes like, your algebras, your Englishes, and things like that in college. And then you declare nursing as your major, and then you go from there. But that was not the question she had. What classes are we taking in high school, specifically high school, that will help set us up and prepare us for nursing? First and foremost, let's go ahead and tackle those science classes. So you want to take a biology class, if you can. And in my high school, now mind you, I graduated from high school in 1996. So I'm sure things have changed since 1996. And in 1996, I took a class, or at least in high school, I took anatomy and physiology. That class was considered to be an advanced class, but I took it anyway. So if you have anatomy and physiology in your program at your school, you definitely need to take it. So anatomy and physiology, biology, and chemistry. If you have chemistry in your class in your high school, you need to take a chemistry class. Now, math. When it comes to math, you want to take something along the lines of algebra. And if they have a statistics class, some high schools have a statistics class for like your more advanced overachiever students. If they have a statistics class, go ahead and sign up for the statistics class, because you have to take statistics in college to get into nursing school, at least most of them. I took statistics, and it was very, very difficult in nursing school. So, or in for my other degree, my psychology degree, and it just happened to transfer into nursing. But take statistics. Also take all right. And so a lot of schools also offer a Spanish. I was talking about Spanish. Definitely take Spanish if you can, 1 to 2 years. That will help you when it comes to talking to your patient. It may not be medical Spanish. It may not be medical Spanish, but at least it's something that you can have general conversations with your patient, or at least understand a little bit about what they say. I know enough Spanish to get me through my shift. And anything else I need to do, I can just get either language line, or a lot of the patients that I have apps that they can talk back and forth in English and Spanish, and we just go back and forth like that. So, but learn some Spanish if you can. That will definitely help you. Some high schools have a health science focus, I guess. And there's a class that a class or classes that you can take that actually, if when you finish, you become a CNA. So with that being said, if you have that program or that in your school, definitely take that. So I think those will be some things that will definitely help you with going to nursing school. 2 more classes that I recommend if possible is food and nutrition. If you have a food and nutrition class there that you can use as an elective, that will help mentally guide you into your teaching aspects in terms of what you need to teach your patients about healthy diets and things like that. And psychology. Psychology is a class that is required in going to nursing school for a 4-year program. And so that's usually taken in college, obviously. But I know at my high school, we actually had that class available in high school. So I took psychology in high school. It's psychology, a general intro to psychology course in high school. So I think that those would be very, very good. So again, to recap real quick, your sciences should include chemistry, biology, and anatomy and physiology if you have it available. You should take Spanish for 2 years if you can. You should take the math class should be your algebra classes and statistics. Your take a food and nutrition class, psychology class, and if your program or your school offers a health and science track that has you take a course that will allow you to be a CNA when you graduate from high school, definitely take that. Now, I will say this as well. Many of you in high school will also be considered to be dual enrollment students, which means you're taking high school classes, but you're also taking college classes at the same time. If that is an option for you, look into some of those classes if possible. Get your English classes out the way. Get maybe Spanish out the way. Get some of those classes out the way so when you actually do get to class, when you get to college, you can start focusing more so on your nursing track versus the basic classes you take in high school. So be mindful of those types of things. You want to be able to take those classes. And if you have a dual enrollment, definitely capitalize on that and get some of those classes out the way very, very early. So I think that answers her question. She just wanted to know, generally speaking, what classes should she take? And those are the gist of those classes that you should take if you're trying to go to high school, trying to go to college, and declaring pre-nursing and eventually nursing as your major. Now, those classes I'm speaking of specifically are for if you want to go into, well, I guess any program. I was going to say maybe the 4-year program. But if you're trying to go to nursing school, whether it be an LPN, RN, 2-year RN, or 4-year RN, all those classes will prepare you for that. A lot of these classes will repeat themselves when it comes to you going to college, because you'll have to take them again at the college level. So that's why I say if you can take some of these classes during dual enrollment, definitely go ahead and do so. But if not, go ahead and nip out a lot of your English classes, your art classes, your basic classes that you can get out the way. So when you do get to keep saying high school, when you do get to college, you can go straight into your not straight into, but get closer to your pre-nursing courses that you actually need besides those fundamental core classes. And when you get to college, you will take anatomy, physiology again, and things like that. So I think a lot of those classes in high school will prep you for those classes in college, and you will make better grades if you're prepared. So anyway, that ends this video for today. I hope this is helpful to you. If you have other questions you have regarding getting into nursing programs, please definitely either DM me on IG. My IG is melaninRN_MPN. The banner's at the top. You can go ahead and click one of those to find me over there. But with that being said, definitely subscribe, click, share, comment this video. I did not realize that I had at least one person who was watching me who was in high school. So if there's one, there's possibly more than one. And we need to reach those students right now while they're making those decisions about what career choices they want to make. We need to reach them now. So help me reach them by sharing this video with whoever, so that it can be put out there for YouTube to put it out there so that they can see that this is very important for us to recruit more nurses, more potential nurses into nursing profession. So until the next time, you all take care. Bye-bye.